I'm Jasmine Gonzalvo, and I'm a clinical associate professor at Purdue University College of Pharmacy and a clinical pharmacy specialist focused in ambulatory care at Eskenazi Health in Indianapolis, Indiana. I've been a pharmacist diabetes educator for over 10 years now.
And I'm Shannon Eaves. I'm a psychiatric clinical pharmacist at Eskenazi Health. Jasmine and I work together in a clinic for people diagnosed with serious mental illness, which includes individuals who are diagnosed or who have diagnoses such as schizophrenia, bipolar disorder, and major depressive disorder.
The two of us, along with several of our colleagues who have a variety of expertise in the psychosocial care for people with diabetes, have developed a practice paper for AADE that focuses on practical approaches to mental health for the diabetes educator.
This practice paper gives a nice overview of how to help support persons with or at risk for diabetes and concurrent psychosocial concerns or mental illness.
In the United States, 17.9% of individuals are affected by mental illness. Individuals with diabetes are at greater risk for depression and other mental health conditions as compared to the general population. Our team conducted a survey to identify the most common psychosocial conditions encountered by diabetes educators. We found that depression, anxiety, and diabetes distress are most commonly encountered in practice.
One of the biggest barriers in caring for individuals with diabetes experiencing psychosocial conditions is a general lack of mental health resources or access to mental health professionals. We'd like to propose 3 things that diabetes educators can do to support people with diabetes who experience psychosocial conditions. Understanding the relationship between diabetes and mental health, having an awareness of how medication can affect cardiovascular health and management, and lastly, knowing the appropriate referral sources you can turn to when helping in the management of someone with diabetes and concurrent mental illness.
In this paper, we talk about the impact that conditions such as diabetes distress, anxiety, cognitive dysfunction, and others have on the management of diabetes. We also provide practical suggestions for identifying associated risk factors, using basic assessment tools, and utilizing helpful resources.
Our second point we wanted to highlight is to be aware of how medications can affect cardiovascular health and management. Multiple factors contribute to higher morbidity rates for diabetes in persons with mental illness. Various organizations, such as the American Psychiatric Association, have noted that psychotropic medications frequently prescribed for individuals affected by various mental health disorders may exacerbate cardiovascular complications. This practice paper identifies what medication classes to be mindful of during your assessment.
The American Diabetes Association and AADE have highlighted the critical role of diabetes self-management education and support given potential psychosocial benefits, including the reduction of depression. Additional mental health services also promote the use of effective coping strategies. Identifying the primary reason for mental health referral is important because it can promote the selection of appropriate resources. Similar to other professions, mental health professionals have diverse areas of expertise. In our practice paper, we have helpful suggestions on how best to identify the appropriate mental health resource for a variety of diagnoses.
These 3 points focus on our goal of delivering person-centered care. Another important component of the practice paper is centered around stigma, and negative attitudes associated with seeking mental health care has been identified as one of the many barriers associated with treatment access and utilization. This position paper addresses stigma and how to effectively communicate about mental health to individuals with diabetes.
We've given you the quick overview on AADE's newest practice paper on practical approaches to mental health for the diabetes educator. We hope you'll take the time to give it a read, let your colleagues know about it, and also share about it on social media. Thanks for taking the time to listen to us today. Go to diabeteseducator.org/mental health to find our paper and other mental health resources.